Hey Adrian, are you there?
Yep, I'm here. What's up?
This woman who calls herself a clean ingredient advocate wants to know why nutrition experts, she put that in quotes, are critical of the Make America Healthy Again movement. Do you want to help me answer her 11 questions?
Yes, I think that will be a good idea to help clear up some of the confusion as to why most nutrition and health professionals are not on board with this movement, even though we dedicate our lives to trying to help people get healthier. Let's do it.
Well, over half of nutrition research, especially when it comes to public health in the United States, is funded by the federal government. And when it's not, a major part of our 10 plus year training that it takes to become a proficient scientific researcher is to be able to identify funding bias and use that when assessing the quality of the results. Nutrition research is done globally, so we use research from all over the world to draw conclusions. And of course, we're aware that evidence can change conclusions. That's exactly what scientists attempt to do, is to disprove the hypothesis, which is fundamental to the scientific method.
Yes, of course, I agree with this. However, increasing access to fresh food for the most vulnerable populations relies on increasing funding for the USDA Food and Nutrition Services. I haven't seen one person associated with this Make America Healthy Again movement mention this, and this movement is associated with a guy who consistently cuts funding to these programs.
This one's interesting. It's like asking why aeronautical engineers and experts in civil aviation aren't part of a movement that's getting people to fear airplanes based on inaccurate information in favor of their unregulated supplemental flying devices. Scientists aren't involved because the movement focuses on made-up science that ignores the real science-backed strategies to improve public health, which is probably why they haven't brought in a single food or nutrition scientist or public health expert when talking about food and nutrition science and public health.
Both Jessica and I have been working in this field in a variety of different settings our entire adult lives. We have dedicated ourselves to helping people to improve their health through nutrition. If we thought there was any merit to any of the things being proposed as a part of this movement, we would definitely be on board.
Well, of course, but that's not what this is about. If the other party's campaign had aligned with RFK Jr. and a bunch of influencers hawking unregulated supplements like the $78 greens powder on your website, who have a history of spreading incorrect information, all to make America healthy again without working with any relevant experts or addressing the actual evidence-based factors that could improve the health of Americans, scientists would be critical of that movement as well.
At this point, we have decades of research, along with hundreds of thousands of papers, that have helped us to develop a pretty good understanding of the relationship between nutrition and health, and that is worked into the current guidelines. And yes, science will continue to evolve, and the guidelines will change as they have in the past as science evolves. Just because you don't understand how any of it works doesn't mean it's a conspiracy. And your information is being labeled as pseudoscience because it is pseudoscience, not because it's against the status quo.
I'm not going to address the environmental toxins one since that one's outside my scope of practice. You see how I stay within my scope of practice so that I ensure that I'm giving accurate information because it's absolutely impossible to be an expert in multiple different areas. But yeah, every single thing that we consume has an impact on human health. Why are you saying though that these additives aren't being further investigated or monitored for safety? They absolutely are. That's one reason why the United States ranks third in the entire world for quality and safety of our food supply, according to the Global Food Security Index compiled by a well-respected firm in the United Kingdom. Just because you say that they're not being monitored doesn't make it true.
I'm all for getting food industry influence out of the dietary guidelines. However, most people don't even know what the dietary guidelines are or don't follow them, and the reality is they're not that bad. I agree with most of them. My question to you is, do you think that your credibility is affected by selling hundreds of pseudoscientific products on your site, or do you think that has no influence on the information that you give?
Do you see how swapping one additive in a high sugar, low nutrient dense food with a different additive that you feel is safer will do absolutely nothing to improve human health and will likely increase the cost of goods for low income individuals? Do you see how you bringing up helping lower income individuals through a movement that is not focused on food insecurity, food deserts, expanding funding for things like SNAP, WIC, and the National School Lunch Program, helping the built environment so people can walk more, and expanding access to healthcare is incredibly misguided?
Government has never refused to create a rating system. Now you're just making up stories. The reason that there isn't a rating system is because there are thousands of foods on the market, and creating a rating system around that would be incredibly difficult, and there are thousands of new products introduced each year. In addition to that, a rating system would be met with extreme opposition from the food industry, and if you thought food industry lobbying is bad now, imagine creating a rating system where you can rate foods higher and companies being able to influence that.
Of course we're aware that those corporations that have been enabled by pro-corporation deregulatory policies disproportionately negatively impact low-income communities. Is your suggestion that the administration that Maha has aligned itself with, which was one of the biggest deregulation administrations of all time and engaged in several deregulation efforts with regard to food and nutrition in this country, including rolling back nutrition standards in the National School Lunch Program, delaying food labeling and calorie labeling requirements, which enabled big food companies to be less transparent on their labeling, and several other deregulation efforts that directly targeted food safety and water safety. That administration is going to now regulate these food companies. I am all for that, but it's not off to a good start since the chief of staff that was just appointed is a lobbyist for a major tobacco company and whose lobbying firm represents big food companies like Kellogg's and Coca-Cola.